Hello. Welcome to Cliniversity.
Okay. So as you can see, medical coding is the translation of medical terms for diagnosis and procedures into code numbers. I mean, the code numbers are the combinations of either numerical values in different types of coding system it is. So it could be either numerical values or it could be the combination of alphabets and numerical numbers. So translation of medical terminology, whatever reported for diagnosis and procedures, is converted into code numbers from standardized code sets. Tell payers that through the medical coding, it is conveyed to the payers, the one who is going to pay, that is the insurance company who is going to pay for the treatment and diagnosis of patient to the providers. Here, providers are nothing but the healthcare professionals like any physician at their clinic or any hospital, etc. So this medical coding indicate payers that the services provided were medically necessary and complied with the payer's rules. That's how they are eligible to be paid. Accurate claims bring maximum appropriate reimbursement for the medical office. Now, in the types of medical coding, you can see there are different types of codes, medical codes, that are categorized under ICD classification, CPT, HCPC, that is HCPS, PCS. ICD is about international classification of diseases. So any disease with which a patient has suffered and received medical treatment, for that codes are coming under this category. So international classification of diseases or ICD codes are there. This code set was established by WHO, that is World Health Organization, in the late 1940s. Now these are the diagnostic codes that create a uniform vocabulary for describing the causes of injury, illness, and death. Here, we need to remember symptoms are not coded. For any disease condition, if symptoms are there, those symptoms are not coded. It's been updated several times in the 60 plus years, in the last 60 plus years since its inception. For example, the code that's currently in use in US is ICD-10-CM. CM stand for clinical modification. It means it's the 10th revision of the ICD codes. I mean, the dictionary into which all these codes are existing has been updated for the 10th, and that is the 10th revision. So the ICD-10 CM, in that 10th revision, 10 represents 10th revision of the ICD codes. That CM here indicates at the end stands for clinical modification. So the technical name for this code is the International Classification of Diseases, 10th revision, clinical modification. That is how it is expanded. If it is 9th, so it is indicating International Classification of Diseases, 9th revision, clinical modification. That is how this expansion of the abbreviation is. Now coming to the process, how it begins and how it is going on. So suppose any patient has experienced any diseased condition, so definitely they will visit to hospital or clinic for taking advice from the physician, and then whatever treatment is possible, they will be provided with that. So the diagnosis process involves patient chief complaint, I mean whatever complaint they are making, that is diagnosed by the physician. So physician will do medical diagnosis, and after that, whatever treatment is there or any diagnostic test is there, that will be carried out. And then what will happen? Insurance diagnosis code will be generated. So for any diseased condition for which physician has diagnosed that and treatment provided, that treatment, I mean that disease for which the treatment received by the patient is coded using these dictionaries. So these are the medical dictionaries which are used for assigning code for a particular disease condition. That is what happening in ICD. So the diagnostic codes or diagnosis codes are found in the ICD-9, as I mentioned earlier, International Classification of Disease, 9th revision, clinical modification. Now, use of this ICD-9 code, it is in healthcare, it is mandated by HIPAA for reporting. What is HIPAA? As you can see, it's Health Insurance Portability and Accountability Act. This is a federal law that requires the creation of national standards to protect sensitive patient health information so that it should not be leaked or it should not be disclosed by any hospital or any insurance company, etc. So it's a federal law that required the creation of national standard to protect sensitive patient health information from being disclosed without the patient consent or knowledge. Now here, as per these codes mentioned in this dictionary, that is ICD-9 or whatever, it could be ICD-10 also. So currently we are using ICD-10, which is the updated version. So this dictionary is used for coding the patient diseases, conditions, signs and symptoms. Here symptoms written wrongly. Symptoms are not coded actually. Please ignore this symptom. Then the ICD-9-CM, it is having different volumes. So the alphabetic index in that, it is for diagnosis appear in alphabetical order. The index is organized by condition. I mean, what is the organization of any dictionary if I talk about, like in English dictionary, how it is organized? Obviously alphabetically. Similarly, these dictionaries are also organized. So volume 2 of ICD-9-CM is organized in an alphabetical manner, in an alphabetical order, and the index is organized by condition with which a patient is suffering. Use initially to look up condition. Cross references can be there, lookup term that follows C like that. Like in any condition, if you are looking for the code, in that it will be giving you a kind of guidance. They will mention as C and then page number and code number will be there. Accordingly, you will go to that page number and look into that particular code as mentioned under C kind of guidance terminology mentioned there. So it is for cross-referencing. The alphabetical index is never used alone to find a diagnosis code because it does not contain all the necessary information. Then tabular lists are there falling under volume 1 of this dictionary. Diagnoses appear in numerical order in this. Listing is organized according to source or body system. Like human body is organized based on organ system, right? So listing is organized according to the source or body system. Here, if we talk about how the code looks like. So the code structure is, codes are made up of 3, 4 or 5 digits. Minimum 3 must be there. So it is made up of 3, 4 and 5 digits and a description. 3-digit categories are used for diseases, injuries and symptoms. Categories are further divided into 4 and 5-digit codes also. Now in ICD-9-CM dictionary, we can have different types of codes. One of the type is V code also. V code is for supplementary classification of factors influencing health status and contact with health services. It also identifies encounters for reasons other than illness or injury, maybe a primary code or additional code. So that all such codes are falling under V codes. E code is, E is external. I mean, here E is representing external. Identify external causes of the injuries and poisoning resulting from environmental events. Never used alone as a diagnostic code. Now, if I talk about the conventions of this ICD-9-CM dictionary, so a list of abbreviations, punctuations, symbols, typefaces, and notes. These are there in this dictionary that provide guidelines for using the code set. So conventions, this is just an example provided here. What kind of conventions could be, like you can see parentheses and certain abbreviations as mentioned here, NOS, NEC, etc. Or bracket. So brackets are there. These are used around synonyms, alternate wording or explanation. So anything which is written in such kind of bracket, you should understand it is not anything new. It is just indicating synonym of the given terminology or diagnostic condition for which we are finding codes. Then inside the code, if in the explanation you are finding NOS, it's an abbreviation that means not otherwise specified or unspecified. NEC, an abbreviation that means not elsewhere classified. So NOS is not otherwise specified. NEC is not elsewhere classified. These are used when the ICD-9 does not provide a specific code to describe the patient's condition. So for that particular condition, there is no code in that dictionary, that is ICD-9. NOS is for, I mean, this is the final code, what you are looking for, and there is no other code or there is nothing otherwise specified. That's how NOS and NEC are used. So next is parentheses. These are used around alternative wording. I mean, for any word, if any alternative wording is there, so parentheses will be provided around that word. Then how will you find code? So steps to locating an ICD-9 CM code. First, you should locate the patient's diagnosis. So a coder, medical coder, will look into the whole patient's medical report and locate what all patient's diagnoses are as per the provider. Find the diagnosis in alphabetic index. So whatever diagnosis they have located, they will cross-check that term in the dictionary and they will find alphabetic index in that dictionary. Now locate the code from the alphabetic index in the tabular list. So in the alphabetic index, you will find tabular list. Inside that tabular list, read all the information to find the code that corresponds exactly to the patient's condition, what the coder has located under the patient's diagnosis. Then record that particular code on the claim form so that this record, this record, when it will go to the next team, that is the medical billing team, they will cross-check that code assigned by the medical coder for this patient's diagnosis located from the patient's report. So accordingly, that billing team will, you can say, approve the payment part as per that code assigned to the providers or to the hospitals. Okay, so these are the steps. First, locating the diagnosis, then cross-checking that diagnostic term in the alphabetical index in the dictionary. Then under the alphabetical index, you will get tabular list in which exactly codes will be assigned for that condition. Then you will look into all the information provided, in front of that code. That means you are assuring that it is as per your diagnostic term what you have located. So you need to read all the information to find the code that corresponds to the patient's condition. And next you will record it in the claim form so that billing team can work on that and can approve payment. Now, another dictionary, which is the updated version of ICD-9, is ICD-10 CM or ICD-10 PCS. Revisions to ICD-9 CM led to ICD-10 CM dictionary. Around over 68,000 diagnostic codes are there in this dictionary. ICD-10 PCS comprises around 87,000 procedural codes. So in ICD-10 CM, we have diagnostic codes, while if any patient is going to through a certain procedure during their therapy, so for that we are using ICD-10 PCS dictionary, and it is comprising around 87,000 procedural codes. Features of this dictionary, updated version of this dictionary, is combination codes are provided, codes for laterality are there, expanded codes capture more details as per the diagnosis or procedure detail provided in the patient report. Flexibility and expandability is there. Now, to review the first digit of an ICD-10 CM code, as you can see here, when reviewing happens, so to review, the first digit of ICD-10 CM code is always an alphabet and second digit is always a numeric. This is a rule, this is a thumb rule, that for any code which is assigned as per this ICD dictionary, the first part of the code, that is the first digit of that code will be an alphabet. The second will always be a numerical. Then third could be any alphabet or numeric value. So that's how it goes. And a code must have minimum 3 characters and maximum it is having 7 to 8 characters. So that is what it is written. The first digit of ICD-10 CM code is always an alpha bit, and the second digit is always numerical digit. And digits 3 to 7 may be any alphabet or numeric. Here is certain simplified look at ICD-10 CM's format, so you should have an idea that what we are talking about. This is through the alphabet index. We will find under that tabular list will be there, what is mentioned here. So A01.0, this is indicating disease of lungs. First is A01. This is indicating certain disease related to a particular organ system of the human body with which patient suffered. So it could be respiratory system, right? Like here, you can, if you go under that tabular list, you will find more refined codes which will give you an accurate and exact code as per the diagnosis what you have located in the report. If you remember, I discussed here uh, about alphabetic index and then tabular list, right? This is what it is showing here. This is as per the alphabetic index. In that, you can find the tabular list in which exact codes are given. So suppose certain disorder is there related to lung, which could be acute or which could be chronic, right? So in that condition, or sometimes certain medical conditions are there which are leading to certain other complications. If that kind of detail is there in your report, you need to identify that in from the report, and accordingly you will assign code. So for example, as mentioned, A01.0, it is indicating disease of any disease of the lung under which the complexity of that condition is given, say it is acute. Simple is indicating acute. Then A01.02 is indicating complexity, could be mild or moderate or severe, whatever it is. Then 0.20 affecting the trachea. That means that condition which is complicated also and now leading to certain other complication. That means affecting trachea. Here, another related to trachea only, what exactly complication mentioned, if it is there in the report, so you will look for that also. So under this only, as it is mentioned, A01.021 affecting the cardiopulmonary system. So like that, you will keep on digging more specific and specific and specific code as per the diagnosis given in the medical report. Okay, that's it. That is how it goes on. Similarly, you can see A01.021A initial encounter, 021D is subsequent encounter, or 21S indicating sequel. This is for example, a patient having certain, I mean, a patient having heart attack for the first time. Patient was treated with certain treatment process, and then later on, they experienced another sequel of it. So accordingly, you will check for the code under that particular condition. That is what this two things as mentioned here indicating. So we keep on looking for the specific codes as per identified diagnosis in the patient's medical report. And whatever is the suitable code you have found, that you will mention in the or record in the claim form. Now, this chart is indicating uh, certain medical codes as per the diseases related to different organ system, like A00 to B99. It's a range in between, multiple codes would be there, and to what it is related. I mean, this range is related to certain infections and parasitic diseases. So guys, try to understand here. When we look into the medical dictionary, any medical coder has to be expert in looking medical dictionary and accordingly finding codes. So when you look medical dictionary, you will see uh, the whole dictionary is divided into different chapters, or you can say volume or topics, depending on the different organ system or diseases coming under different categories might be under the same organ system. Okay, so that is how different chapters are there under which you will find ranges of codes belonging to certain topic, and accordingly, as per that topic, you will look for your code as per your medical condition or diagnosis. So here as range, you can see A00 to B99. This is one range provided here. It is covering all the topics under infections and parasitic diseases. Now, parasitic diseases could be anything, right? So infections could be anything. So that whatever is there in your report, accordingly, you will cross check under this range. Then another range is C00 to D49. This is related to neoplasm. D50 to D89, it is related to disease of the blood and blood forming organs and certain disorders involving the immune mechanism. E00 to 89, endocrine, that means any kind of hormonal imbalance if it is there, or malnutrition is there, metabolic diseases is there. So all is covered under E00 to E89. Accordingly, you will cross check your specific code. F01 to 99, it is about mental, behavioral, and neurodevelopmental disorder. Then G00 to 99 is about diseases of nervous system. Then H00 to H59 is about diseases of the eye and adnexa. 60 to 95 is about disease of the ear and mastoid process. I100 to I99 is about diseases of circulatory system. Like that, as you can see, different ranges are there belonging to different organ systems to which a particular disease uh, related to. And exact disease, whatever is there in the report, for that, under this range, under this diseased condition, we will cross check that particular specific code. How to look for that specific code also, as mentioned here, I showed, right, in this slide. So next question arises that basically what all their differences are there between ICD-9 and ICD-10 codes after its updation and all. So the Department of Health and Human Services, that is HHS, recently announced that ICD-9 codes will be replaced by the newer ICD-10 codes beginning, right from the 1st October 2015. So what all differences are there? Certain differences have been listed here. First is number of digits used in codes. So ICD-10 diagnosis codes may contain more digits than traditional ICD-9 codes. ICD-9 codes can contain between 3 and 5 digits, as I told you before, but ICD-10 can be anywhere from 3 to 7 digits long. This is done in order to create codes that are more specific in addition to accounting for diseases and conditions not covered under ICD-9. So actually, it's an effort to cover more precisely different types of diagnoses, what are there reported in the patient's report, and accordingly, specifically treatment provided for that particular condition. So when expansion happened with the number of characters in a particular code from maximum of 5 to maximum of 7 under ICD-10, so this gives an opportunity to the updaters of this dictionary to go for and cover more precisely all kind of possible conditions with which a patient can suffer and needs to take treatment. So the next difference is about the first digit of that particular code. So ICD-10 codes begin with a letter, the alphabet, while the first digit of an ICD-9 code can be either, it could be alphabet or numeric, both, any one of this. But here in ICD-10 code, mandatorily the first letter, the first character of the code will always be an alphabet. As such, one of the easiest ways to determine if you are using ICD-9 code is to make sure the first digit is not a number. So easily, if you look into a code which is for from ICD-9 or another code from ICD-10, you can differentiate. For example, the first character, if it is a numeric value, uh, indeed the another code what you have found is an alphabet, so you can find out that okay, this is from ICD-10 and another one is from ICD-9. But here you have to be careful because CPT type of codes, medical codes, that is for procedures actually, whatever procedures are carried out or other services provided to the patient, for that codes are assigned from CPT. So those codes are also having numerical values only. Okay, so you have to be careful here that any code whose first character, if it is a numerical value, then is it so? The next thing what you need to look into is whether it is for a procedure or it is for a condition, that is a diagnosis. Accordingly, you will differentiate. Okay, this should be for from CPT dictionary and this should be from ICD-9 dictionary, right? So that's how the first character gives you an idea that what kind of code or what kind of dictionary from which this code has been taken. Then the second digit of any code. So there is no change when it comes to the character requirement for the second digit of an ICD-10 code. The second digit of both ICD-9 and 10 codes are always numeric. Third and subsequent digit, previously digits 3 through 5 of the ICD-9 codes were always a numerical value. Third and subsequent digit of ICD-10 codes may be either alphabet or numeric. Okay, so suppose a code is there A0123. So here A is an alphabet, 0 is a numerical value, which is mandatorily from ICD-10. But A0123, when I'm saying, so this in place of 1 could be B, C, etc. if it is taken from ICD-10. But it will be always a numerical value, as I'm saying it is 1 in this case. So it is indicating that it is from ICD-9. But from ICD-10, it will always be it will always be, I mean, it could be any alphabet or it could be a numerical character. Ability to add new codes. One of the biggest reason for the change from ICD-9 and 10 is the ability the new system brings when it comes to adding new codes. ICD-10 provides a great deal of flexibility for creating new codes, making it easy to add recently discovered diseases. The old system contained approximately 17,000 codes, but there are nearly 160,000 included in the new one. Even more codes may be added to ICD-10 as time goes on. Specificity, if we talk about, so as you are having a larger number of codes to be selected or chosen from this dictionary as per the patient's report, obviously it is giving us this opportunity to be more and more specific as per the reports provided. So ICD-10 codes are also very, very specific and are therefore designed to eliminate coding errors. I mean, it should not be like that in the report some condition is there for which that was diagnosed by the provider, and provider has treated this patient for that particular condition, but some related diseased condition was coded by mistake, and that is a kind of error for which insurance company has to pay. So that should be avoided. It's a kind of serious error. So to eliminate all such kind of coding errors, ICD-10 is providing more specific codes as it is having a larger number of codes that could result in denied claims. So many believe being more specific. I mean, whenever any kind of coding error is there, so medical billing will deny the claim. Thereby, there will not be payment to the hospitals or providers. So that's the reason delay in the payment or billing process, or to prevent or avoid non-payment or denial of the claims, it is mandatory that coding must be done accurately. Many believe being more specific will also lead to improved patient safety, a more accurate and detailed diagnosis, and fewer requests for documentation to support a diagnosis. It should also lead to fewer claims being denied due to a lack of medical necessity. So if this was about all about ICD-9 and 10, what we have learned till now. The next type of medical coding is procedural codes that are for procedures performed at the site by the providers or hospitals. And these codes are compiled under CPT. So CPT is current procedural terminology. This is a book or dictionary, the most commonly used system for reporting procedures and services which is provided to patient from any clinic or hospital. This is again a HIPAA required code set published annually by the American Medical Association, that is AMA, and this is also updated annually, and it used the appropriate CPT book, that is the dictionary, for current year. So whenever there is coding going on in the company, they always try to use updated version. So CPT codes are 5-digit numeric codes that are divided into 3 categories. The first category is used most often, and it is divided into 6 ranges. These ranges correspond to 6 major medical fields. Now, I'm talking about the first category. Okay, there are 3 categories under CPT codes. The first category having 6 ranges, and these ranges are evaluation and management, anesthesia, surgery, radiology, pathology and laboratory, and medicine. These are the 6 medical fields which are covered under 6 ranges under first category of CPT codes. The second category of CPT codes corresponds to performance measurement and in some cases laboratory or radiology test results. So it will cover all those informations or details mentioned in patient record, which is related to any kind of lab or certain lab and radiology test or certain kind of other performance measurement if it is carried out. The third category of CPT codes will correspond to any emerging medical technology which is performed for the patient.
For more details, connect us on given details on screen. And don't forget to follow us on our social media. Thank you.